For item 9, best language, we score the patient's language skills. Listen for this item as you perform the entire stroke scale examination. By this time, you'll know a lot about the patient's ability to comprehend language, and you may be able to score the item. However, it's almost always wise to confirm your impressions developed to this point in the exam using the formal testing tools provided. This scale item is an exception to the rule of scoring only the first impressions. We encourage, but do not coach or stimulate the patient's best performance. The patient's language is tested by having the patient examine the cookie jar picture and the standard naming card, and by reading a series of sentences. The objects and sentences are provided with the stroke scale exam. Always determine if the patient wears glasses. If so, they will be needed for the exam. Give the patient adequate time to identify the objects on the object card. Ask the patient to name each item on the card. Ask the patient to describe the meaning and action depicted on the cookie jar picture. Encourage, but do not coach the patient to be as complete as possible. Ask the patient to read all the phrases on the sentence card. The assessment is based on your overall sense of the patient's language as well as on their responses on these tests. I'd like you to put on your reading glasses here.
Okay.
All right. I'm going to show you a card. I want you to tell me what you see in that picture.
Socket. Hostess. And going outside. Just washing. And falling down.
Falling down. Good. Now I have some pictures. Can you tell me what that is right there?
Glove.
Okay. And that right there?
Feather.
Good. And this one?
Hammock.
Good. And this one?
Chair.
And this one?
Cactus.
Yeah.
Yeah.
And this one?
Key.
Good. That's great. Can you read these sentences for me?
You know how, down to earth, I got home from work. Near the table in the dining room. They heard him speak on the radio last night.
For scale item 9, this patient scored a 1. Let's look at how this scale item is scored. Score a 0 if there is no aphasia. Score a 1 for mild to moderate aphasia, evidenced by some obvious loss of fluency or facility of comprehension, but no significant limitation on ideas expressed or form of reductions. A limited reduction will still allow you, as the examiner, to identify the picture or naming card content from the patient's responses.
What I'm going to do is give you this picture here, and I'd like you to tell me what you see in that picture. Describe to me what you see there.
Well, boy has getting cookie jar. Now he's falling on the stool.
Very good. Do you see anything else?
Sloppy people. Okay.
Yeah.
Like that.
What else do you see?
The lady has washed the dishes and overflow the sink.
Excellent. Okay. Now what I'd like you to do, I have another picture, and I'd like you to take a look at this and tell me what that object is right there. What is that right there? Can you tell me the name of that object?
Glove.
Excellent. How about this one?
Key.
How about
Chair. Cut. I cannot pronounce.
Okay. How about
Cat. Cuts.
Good. All right. How about this one here?
Feather.
And this one here?
Hammock.
Okay.
Score a 2 for severe aphasia when all the patient's expressions are fragmentary or when you cannot identify card content from the patient's response.
Ask her if there's anything in that picture she can tell us.
Ma, mira el dibujo y ¿qué están haciendo ellos? A ver, trata de decir qué es lo que están haciendo. No, aquí. Mira el dibujo. ¿Qué está haciendo ella?
Tell you what, let's try a different one and see. What I'd like her to do is look at the card and tell us if she can point to the chair.
¿Puedes apuntar dónde está la silla? La silla, mira el dibujo. ¿Dónde está la silla? Toca la silla con tu mano.
Okay.
Score a 3 if mute for any reason, or for global aphasia, or if no usable speech or auditory comprehension is demonstrated. The examiner must choose a score of 3 for the patient with a stupor or limited cooperation.
Would you take a look at this card? Is there anything that you can tell me about it? I'll hold it where you can see it. Can you speak at all about that card? Let me try one more thing. I have a few pictures here. Can you tell me what this object is on the picture card? The intubated patient should be asked to write down responses to the examiner's questions. If a patient's visual loss interferes with testing this item, you may ask the patient to identify objects placed in the hand. You'll also need to elicit samples of speech. On the naming card test, it is very common for visually impaired patients to identify the feather as a leaf and the glove as a hand. Also, in some parts of the country, the cactus picture will be identified as animals in profile, such as squirrels. I usually score these responses as correct. Hammocks are not common outside of the Americas, so patients from other cultural groups may not know the term. Patients scoring a 3 on level of consciousness 1A are scored 3 on this scale item. Mute patients may have some cause other than aphasia for not speaking, but to optimize scoring reliability, you always give the mute patient a 3. Remember, score what you see, not what you think the patient can do. In item 10, dysarthria, we test the patient's articulation and clarity of speech. It's important that you don't explain the purpose of this exam. Ask the patient to read or repeat the words from the word card provided with the stroke scale. So I'd like you to pronounce these words for me.
Mama, tip-top, 50-50, thanks, huckleberry, baseball player.
Okay.
For scale item number 10, this patient scored a 1. Let's look at how this scale item is scored. Score a 0 for patients with normal speech who read all words without slurring. Score a 1 for patients with mild to moderate speech defects and some slurring, but who can be understood.
Would you read those words for me, please?
Mama.
Mm-hmm.
Tip-top.
Mm-hmm.
50-50.
Mm-hmm.
Thanks.
Mm-hmm.
Huckleberry.
Good.
Baseball player.
All right. Very good.
A score of 2 is reserved for the patient who cannot be understood in any meaningful way or who is mute.
Would you ask her to say mama?
Ujú.
Ask her to say mama.
Mamá. Di mamá. Ma, ma. Ma, ma.
Okay. An unresponsive patient receives a score of 2 on this item. Patients scoring a 3 on level of consciousness 1A are scored 2 on this scale item. The item is untestable only if the patient is intubated or has other physical barriers to producing speech. Remember to clearly document and explain this problem on the form. Aphasic patients and patients who do not read may be scored based on listening to the speech they do produce or by asking them to repeat the words after you read them out loud. In some cases, the speech may be hard to understand due to dental or other non-neurological causes. Nevertheless, score the item a 1 to optimize reliability among examiners that might have varying degrees of experience. We come now to the last scale item, which tests for neglect or inattention. You may have enough information by the time you reach this point in the exam to make a judgment, but if abnormalities are not clear, the presence of neglect is examined by the patient's response to double simultaneous stimulation. Unless there is obvious neglect or anosognosia, it is wise to double check. First, ask the patient to close their eyes. Alternately touch the patient's left or right side, and ask the patient which side is being touched. After the patient responds consistently, then touch the patient on both sides at once. The patient without neglect will identify sensation on both sides. Patients with cortical impairment may extinguish one side. That is, they will only perceive sensation on one side. Since neglect is scored only if present, the item is never untestable. Now, the last thing I'd like to do is tap you on the right, left, or both. You tell me which it is, all right? Close your eyes. We'll start with your face. Right, left, or both?
Okay.
Can you say if it was left, right, or both?
Okay. Right.
You know what might be easier for you is if you take your finger and point to the side that I'm touching. Okay? Point to the side that I'm touching. Good.
Right.
All right.
Left.
Good.
Both.
Excellent. Now, you're able to pronounce it now, so let me try the hands. You tell me if this is right, left, or both.
Right.
Good. Okay.
Left.
Wait for me to touch it.
Both. Both. Left. Right. Both.
Beautiful. Keep your eyes closed, and I'm going to tap your legs.
Right. Left. Both. Left. Both.
I'd like to do the same thing now in your vision. You can point to the finger that wiggles. It'll either be right, left, or both.
Right. Left. Right. Both. Both.
Good.
For scale item number 11, this patient scored a 0. Let's look at how this scale item is scored. Score a 0 for the absence of neglect. If the patient has a severe visual loss, preventing visual double simultaneous stimulation, and the cutaneous stimuli are normal, the score is normal. If the patient has aphasia and cutaneous stimuli are normal, the score is normal. Score a 1 for inattention to only one modality, visual, tactile, auditory, or spatial. If the patient does not extinguish but shows other well-developed evidence of neglect, score a 1.
I want you to tell me if you see a finger wiggling on the right side, left side, or both sides. Where's that?
That's left. Right. 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 Left. Right. Right.
Okay.
A 2 is scored for profound hemi-inattention or extinction to more than one modality. Score a 2 if one side extinguishes to both visual and tactile stimuli using double simultaneous stimulation. Score a 2 if there is inattention to more than one category, visual, tactile, auditory, or spatial inattention. A patient with a score of 3 on level of consciousness 1A is automatically scored a 2.
As soon as you finish, add up the scores from each item to derive the total. It is always wise to be sure that you have entered the scores correctly, especially on items 1B and 1C. Many people have a tendency to write a 2 when the patient scores both items correctly. We have completed basic instruction in the use of the NIH stroke scale. As you have seen, the scoring rules are rigid and arbitrary, and in some cases counter to typical neurological practice. However, if the scoring rules are followed, the scale scores will be highly reliable and reproducible. To help you master the art of scoring the NIH stroke scale, we have placed guided interactive patient assessments on this disc. Using these patient assessments, you will have the opportunity to observe again how each test is given and how patients respond, and to practice scoring performance on each item of the scale with the opportunity to compare your scoring judgments to those of experienced clinicians.